Welcome back to Monday Special. Of course, the discussion continues on depression. I'm now going to invite on set Dr. Catherine Mutisya, who's a psychiatrist and Deputy Medical Superintendent of Mathare Hospital. Thank you very much for making time for us. We had talked earlier, and what captured me immediately was depression is in itself a mental illness.
Yes, depression is a mental illness which usually affects the feelings of the person who is suffering from depression. They'll tend to feel sad. They will get disinterested in the things which they would normally love, like somebody who used to love watching football, they'll not be interested. And it's so severe to the extent that it affects their social life, their occupation. Some people even have suicidal thoughts, and some end up committing suicide if they don't seek treatment.
You treat patients even at Mathare Mental Hospital?
Many people think that mental illness is just a severe schizophrenia, but depression is also a mental illness. And the very severe ones, we actually have to put them on electroconvulsive therapy because medication will take very long to recover, to make them recover. Yes.
And is there any relationship between depression as a mental illness and schizophrenia?
No, there are two different types of mental illnesses, and they are very severe. Both of them are classified as opposed to anxieties. Depression and schizophrenia, one of the severe mental illnesses. And what people confuse depression with is the day-to-day sadness, because we all get sad once in a while in our day-to-day life. But when we talk of clinical depression, it is that person who feels sad, feels worthless, even though they have achieved so much. They feel they have not done much, they are worthless, they don't feel like waking up. Some will even lock themselves, they will not shower, and some refuse to eat to the extent that they get dehydrated, and they actually have to be admitted for rehydration, to be given fluids.
Right. I'll come back to that in a short while. Let's go back to, for example, Mathare Mental Hospital.
Yes.
Many people growing up think the people who are at Mathare Mental Hospital are just schizophrenic. Do you have people with depression in that hospital?
We have many patients who have severe depression, and to the extent that we even have a ward, because the ones who are dehydrated and will need fluids, we have a ward we call infirmary, where we actually, like an acute ward, we give them fluids, we give them special diet, and those who are too sick end up getting the electroconvulsive therapy. But of course the mild ones can be treated as an outpatient. If somebody realizes early, or if the family members notice early and they take them for treatment, they might not need admission. But when it's severe, they will need admission. Yes.
When then does one seek treatment?
When you notice that your loved one, or you feel that you're feeling worthless, you feel sad most of the time, you're not interested. Some people will not feel like going to work. They'll disappear from work for a whole week without permission. And especially when you start getting suicidal ideations, when you feel like life is so worthless, I would rather be dead, then you need to seek treatment. And most of the time, you just observe the people you are living with, your loved ones. If you feel that they seem not interested in what they used to like doing, they are sad, they are complaining, life is well with them, but they don't see the positives, they keep seeing the negative, then you need to encourage them to seek help.
Right.
Yes.
You told me there's one way of treating severe depression, which is
what we call electroconvulsive therapy.
Right, which my director can get right. Yeah, what is that?
They are put under general anesthesia, they sleep in theater, and then a current is passed to the brain to make the hormones be released faster. Because what happens with the antidepressants, they take long to act, like 2 weeks. So if you're getting somebody who has been not feeding for a whole week, they are dehydrated, then you can't wait for this medication to take effect. So you have to resort to treatment which will facilitate the recovery, faster recovery.
That is accessible in this country?
Yes, it's accessible, even in government hospitals and even in private hospitals.
Right, we've seen the Kanyi is one of the panelists, and somebody here already saying, thanks Kanyi for sharing, very brave of you taking that step. What caught my eye is that Kanyi says as early as 11 years.
Yes, depression can affect even children. School-going children and even adolescents, and we are seeing a lot of suicides even among adolescents, and people used to think that children do not understand and they will not get depressed. That is not true. We are seeing many children getting depressed, especially with a lot of stress of a lot of schoolwork and no time to play. and broken families, where you find that in the cities, people like they live in a nuclear family, or like children who lose their parents. It has been shown that especially children who lose their mothers very early, they are prone to depression. Again, there are many factors which affect, which will make people suffer from depression. Of course, there is a genetic composition where you find in a family, you might find many people who have suffered from depression. Yes.
How do you know then a person has fully recovered 100% from depression when you treat them?
Actually, when somebody is able to move on with their life, and for the first episode, we might have to be put on treatment for like 2 years, and it's not just medication. We also have psychotherapy, and that's why we're having Dr. Gladys Muiti on the other side, because we work hand in hand with clinical psychologists to offer psychotherapy. But severe depression will not just respond to talk therapy, because when somebody is severely depressed, they will not even reason to you. They will not see the good things happening in their life. They will minimize their achievements and just concentrate on the negatives. So you have to put them on medical treatment, sometimes even ECT, and then when they recover, then now they can be able to go through what we call talk therapy, psychotherapy.
Yes. Finally, somebody here saying, and keep sending us your thoughts on this. On 2242, somebody says depression and other mental disorders not only affect the patients but the caregivers as well. It is hard for them too, sometimes not knowing what to do, getting frustrated, and feelings of guilt. Question is, how does one cope as a caregiver?
That is very true. In fact, the family might even be more affected than the person you are treating, because this person might not even realize there's something wrong. It might be very hard to get them to hospital because they feel there's no need for treatment. Some might even attempt suicide, and you know, in an African society, when somebody commits suicide, people will think you're cursed, the family is cursed, they don't want to talk about it. It is stigmatized. Most people will not be brave enough like Kanye and to say they have seen a psychiatrist or they're having a mental illness. But we encourage people and tell them it's an illness like any other. No one chooses to get depressed. No one chooses to get any other mental illnesses. So we should not hide, and we should seek treatment. We need to support the caregivers, because usually it's a lot of work. And part of psychotherapy, we have family therapy, where we sit them with them and educate them and teach them how to actually get their person to be assisted. When they don't feel like getting up, sometimes we might even have to take them to hospital forcefully. Yes.
Okay, well, thank you very much. Dr. Catherine Mutisya is a psychiatrist and currently Deputy Medical Superintendent of the Mathare Hospital. Thank you very much for making time for us.